The next question, the member for Timiskaming Cochrane.
Thank you, Speaker. My question is to the Minister of Health. Northerners often have to travel to get access to a specialist. We get that. There's lots of big hospitals down here. We get that. To make healthcare equitable, something called the Northern Health Travel Grant exists. So we often have to travel hours, and we get reimbursed for a hotel room if we have to travel too far. The reimbursement is $100 per night. I would ask the Minister of Health, could she give me a list, or any of her colleagues, of hotels in the actually around here, where you can rent a room for $100 per night?
Deputy Premier and Minister of Health.
Thank you, Speaker. So the member opposite knows that the Northern Ontario Travel Grant is part of a suite of programs that we ensure people have access to health care when they need, in particular, specialists. But we are also building additional primary care in Northern Ontario, in Eastern Ontario, in Southwestern Ontario, in the Niagara region. We want to make sure that people have that access. And the other piece that we are working on to ensure that the primary care piece is absolutely critical is making sure that we are expanding programs like the Orange Air Ambulance. Not only are we replacing our fixed-wing fleet, but we are adding an additional 4. Why? Because we want to make sure that people in Northern Ontario, in Southern Ontario, have access. Another piece that the member, of course, would be familiar with is an expansion in our MRI programs, ensuring that hospitals that have never had an MRI finally have that program in their facility so that they can...
Supplementary question.
Thank you, Speaker. In the Minister's own words, facts matter. And the fact is, it's impossible to rent a hotel room anywhere close to a major hospital for $100 a night. So right off the bat, Northerners don't have equal access. Furthermore, the travel costs do not, which are subsidized by the grant, nowhere come close to what the actual costs are. Yet this government refuses to change the Northern Health Travel Grant. My question is, why? Why don't Northerners deserve equitable access to specialists in the province?